Hi, I'm Dr. Kharrazian. I want to talk to you about some of the key features of autoimmunity associated with Hashimoto's. Many patients that have Hashimoto's actually have more than just Hashimoto's. So one of the things that we routinely do when we see patients that have Hashimoto's diagnosed with either TPO or thyroglobulin antibodies is go, where is the rest of it? So many patients that have Hashimoto's have antibodies and other target proteins. So most common one is actually neurological. So one of the things that we see with patients that have Hashimoto's is that many of them have antibodies to cerebellum antibodies or myelin antibodies, and they have this subtle neuroinflammatory neurodegenerative disease. Most of them will probably never develop into diseases like multiple sclerosis, however some do. Many of them just have this ongoing inflammatory cascade. Besides the brain, another common area with people suffering from Hashimoto's is intestinal inflammation. Between 5 to 7% of Hashimoto's patients have been found to have intrinsic factor antibodies. So that means that they have an autoimmune response where their immune system is destroying the carrier of B12 into their intestines. And for some of them, they'll develop full-blown pernicious anemia and see complete changes of their CBC on their red blood cell profile. But for many of them, they'll just have a subtle B12 deficiency throughout their whole life, and that combined with, for example, a methylation gene uniqueness can really cause significant health problems. Besides intrinsic factor, many patients that have Hashimoto's also have celiac disease or develop autoimmune target proteins that lead them to things like ulcerative colitis or Crohn's. So these are very common in patients that suffer from Hashimoto's. So if you're a clinician, one of the things that you really want to be able to do the minute someone walks into your office that has Hashimoto's is to evaluate where the rest of the autoimmune responses may be. Because in the majority of patients, they have them. It's just a question of can you identify them? And many times, when you're able to identify the rest of the autoimmune responses, then there are a huge list of symptoms narrows down, and then you can find out that maybe that they have chronically low blood pressure and chronic adrenal symptoms, and this chronic need to eat salt because they're having some subtle 21-hydroxylase autoimmune reactivity or antibodies against their adrenal glands. It's not a full-blown Addison's disease yet, but there's some subtle autoimmune reactivity there. And then they may have some subtle joint pain because they're having antibodies against their collagen complex proteins. So one of the things to really make sure you do when you work with patients that are suffering from Hashimoto's is to get the full picture of their autoimmune profile. So in the course that we have coming up called Kharrazian Institute, Hashimoto's Clinical Strategy and Treatment Applications, I'm going to walk you through how to do a very thorough autoimmune workup on every single patient that walks in your office that is suffering from Hashimoto's. Once you understand that workup and the patients can see what these things mean, there is a dramatic improvement in identifying future symptoms and then also learning how to practice preventive models of autoimmunity to really support their health in the future. Hope you can join us, and thank you for your attention.